So now we're going to see the development of veins. Okay. So now we're going to draw the diagram of the lower end of the heart tube. I told you the lower end of the heart tube is called venous end, and that is called the sinus venosus. And the sinus venosus having two horn, right horn and the left horn. So each horn of sinus venosus receive three set of embryonic veins. Okay. So now we draw the diagram. This is our sinus venosus. This is the body of the sinus venosus. And this is the right horn. And this is the left horn. Okay. So this is the body of sinus venosus. And this is the horn of sinus venosus. This is the right horn. And this is the left horn of the sinus venosus. Okay. Right. I told you each horn of sinus venosus receive three set of embryonic veins. Now by fifth week, actually, yes, you can see the three set of embryonic veins open into the horn of sinus venosus. Now first, this is our common cardinal vein. This is our common cardinal vein. See, common cardinal vein, common cardinal vein, common cardinal vein. Common cardinal vein carry the blood from the body wall. Carry the blood from body wall. Okay. So now the common cardinal vein divide into anterior cardinal vein and the posterior cardinal vein. Anterior cardinal vein and posterior cardinal vein. So right side common cardinal vein, right anterior cardinal vein, right side posterior cardinal vein. Anterior cardinal vein and this is posterior cardinal vein. Anterior cardinal vein carry the blood from upper part of the body. Carry the blood from upper part of the body. Posterior cardinal vein carry the blood from lower part of the body. Carry the blood from lower part of the body. Okay. Similarly, left side. Left side anterior cardinal vein. Left side posterior cardinal vein. Left side anterior cardinal vein. Left side posterior cardinal vein. Anterior cardinal vein, posterior cardinal vein, they join together to form left common cardinal vein. This is right common cardinal vein. Right. Now we have two more embryonic veins. Number 2 is our vitelline vein. Vitelline vein carry the blood from yolk sac. Now this is vitelline vein. Carry the blood from yolk sac. I am writing VV here. VV means vitelline vein. I write the abbreviation by the side. So VV means vitelline vein. Vitelline vein carry the blood from yolk sac. Okay. And we also have umbilical vein. Now this is umbilical vein. This is umbilical vein. Umbilical vein. This is left umbilical vein and this is right umbilical vein and this is right vitelline vein. Okay. Right. So now these are the three embryonic veins we have. The umbilical vein carry the blood from placenta. Umbilical vein is the only source of oxygenated blood because they carry the blood from placenta. Now we know already the right umbilical vein disappear very soon after the formation. So the fetus is having only one umbilical vein. Which one? Left umbilical vein. So the right umbilical vein will regress. So we have only left umbilical vein. So please write, right umbilical vein will disappear. Right umbilical vein regress. Okay, we have only one umbilical vein, left umbilical vein. Left will be left. So now see here. Now I told you this part, the left horn of the sinus venosus will regress. The left horn of the sinus venosus will regress. So along with that, the cranial part of the three embryonic veins, they also regress. I told you, the left horn of sinus venosus regress and they form coronary sinus. Fine. So because of that, the cranial part of three embryonic veins on the left side, they also regress. So please write, the left horn of sinus venosus regress. Now because of that, the cranial part of embryonic veins, the cranial part of 3 embryonic veins on the left side, they regress. Is that clear? Now, I told you the only source of oxygenated blood to the fetus is our left umbilical vein. So now the cranial part of left umbilical vein is regressing. So now we need one shunt. We need one shunt. From where to where, sir? From the left umbilical vein to the right vitelline vein, one shunt is formed. Because this will shunt the oxygenated blood from the left umbilical vein to the right vitelline vein. So one shunt is formed. One shunt is formed. From where to where, sir? From left umbilical vein to right vitelline vein. Now this shunt is called ductus venosus. This shunt is called ductus venosus. Ductus venosus. Sorry. Okay. So I told you the only source of oxygenated blood is left umbilical vein. That is the only thing we have. So the left umbilical vein now joined with the right vitelline vein. That shunt is called ductus venosus. Is it clear? Right. Now come to right side. Now right side we have only 2 veins now. What are those? Right common cardinal vein and right vitelline vein. Right common cardinal vein form the, very good, superior vena cava, and right vitelline vein form the cranial part of IVC. Very good. So now please write, please put one box and then write right common cardinal vein. Right common cardinal vein will form the superior vena cava, helps in the formation of superior vena cava, SVC. Whereas right vitelline vein will form the cranial part of inferior vena cava. Is that clear? Right. Now, these are some basics you have to know about the embryonic veins. Now, by this basics, from this basics, we're going to see the formation of superior vena cava, inferior vena cava, and the portal vein. Okay. Right. Now, we draw one by one. First, we're going to see development of superior vena cava. Superior vena cava formation we're going to write. Okay. Right. Now, see the diagram. Now, this is our anterior cardinal vein. And this is the posterior cardinal vein on the right side. And they form the common cardinal vein, right side. Similarly, left side, common cardinal vein. Left side, anterior cardinal vein. And left side, yes, posterior cardinal vein. And they open into sinus venosus, right horn, left horn. So now, this is right side common cardinal vein. And this is right side anterior cardinal vein. This is right side posterior cardinal vein. Similarly, this is left side common cardinal vein. This is left side anterior cardinal vein. This is left side posterior cardinal vein. So ACV means anterior cardinal vein. PCV means posterior cardinal vein. CCV means common cardinal vein. Common cardinal vein. Okay. So now, see the diagram. Now, subclavian vein formation. See, subclavian vein derived from intersegmental vein. This is our subclavian vein. So just we draw one line and write that vein as a subclavian vein. This is our subclavian vein. So subclavian vein is coming from intersegmental vein. That is our subclavian vein. Right side, left side subclavian vein. They are coming from intersegmental veins. Intersegmental vein. Just know this line, that is more than enough. They won't ask much about the subclavian and all, so don't worry. Please remember only one point. The subclavian veins are coming from intersegmental veins. Subclavian artery, I told no. They're coming from segmental arteries, intersegmental arteries. Yes, similarly, subclavian vein is coming from intersegmental vein. Artery, intersegmental artery. 7th cervical intersegmental artery, I told you, subclavian artery will give a contribution for subclavian artery formation. Similarly, subclavian vein is coming from intersegmental vein. Just remember this line, it is more than sufficient. So now, we have anastomosis. The oblique anastomosis between the anterior cardinal vein. So this is the oblique anastomosis. I am writing OA. So OA means oblique anastomosis. Oblique anastomosis between left anterior cardinal vein and right anterior cardinal vein. So now we have this part that will form the right brachiocephalic vein. Now, right brachiocephalic vein is derived from which vein? Right anterior cardinal vein, that is present between. This is number 1, this is number 2. So, what is number 1 and 2? Number 1, subclavian vein opening. Number 2, oblique anastomosis. Okay, so first we're going to write right brachiocephalic vein formation. Right brachiocephalic vein is derived from right anterior cardinal vein. Right anterior cardinal vein, which is formed between right subclavian vein opening, formed between right subclavian vein opening, and number 2, what is number 2? The oblique anastomosis. And number 2, the oblique anastomosis. Fine. So now you got right brachiocephalic vein. Okay. Now what about left brachiocephalic vein? Left brachiocephalic vein is derived from 2 sources. Now this is number 1 and this is number 2. What is number 1 and number 2? Number 1 is the oblique anastomosis. What is number 2? Left anterior cardinal vein. So please write left brachiocephalic vein derived from number 1, the oblique anastomosis between right and left anterior cardinal vein. Oblique anastomosis. Okay. Number 2. Number 2 is the left anterior cardinal vein that is present between the oblique anastomosis and subclavian opening. Present between left subclavian vein opening. Left subclavian vein opening and the oblique anastomosis. Okay. So this one is forming the left brachiocephalic vein. Okay. So now we have right and left brachiocephalic vein. Now next we're going to see the superior vena cava. Now superior vena cava derived from, this is number 1 and this is number 2. So this is we mark as A and this is B. Now this A and B form the superior vena cava. What is A? A is the right anterior cardinal vein. This present between the oblique anastomosis and right common cardinal vein. What is B? Right common cardinal vein. That is forming the superior vena cava. So superior vena cava derived from, what is A? Superior vena cava derived from, what is A? Right side anterior cardinal vein. Right side anterior cardinal vein. Now this anterior cardinal vein is present between the oblique anastomosis and right common cardinal vein. Is that clear? Right common cardinal vein. Okay. Number 2, what is B? B is right common cardinal vein. B is right common cardinal vein. So superior vena cava derived from these 2 sources. Very, very important. Okay. Right anterior cardinal vein that is present between the oblique anastomosis and right common cardinal vein, and B is right common cardinal vein. Now the opposite side, the left anterior cardinal vein present between left common cardinal vein and the oblique anastomosis, this part will regress. I will mark this part. I'll shade this part in yellow color. So this part will regress. So that is left anterior cardinal vein present below the oblique anastomosis. That will disappear. Okay. Right. Now in some patient, the left anterior cardinal vein below the oblique anastomosis persists and forms double superior in vena cava. Okay. So now I'll erase and write here. Now this is our, please write by the side. That is our left side anterior cardinal vein which is present below the oblique anastomosis. Present below the oblique anastomosis. Regress. It is usually regress. Very rarely. Now, left anterior cardinal vein below the oblique anastomosis persist. In some babies, rarely it may persist and forms left side superior vena cava. Now the baby is having two vena cava. Superior vena cava right side and superior vena cava left side. Right and left superior vena cava is present for this baby. Again, this condition is seen very rarely, not usual. Okay, not a usual thing. Now the left superior vena cava, that is our left anterior cardinal vein, that is opening into left common cardinal vein. Left common cardinal vein. So left superior vena cava open into left common cardinal vein. Left common cardinal vein, left vitelline vein, left umbilical vein, they open into left horn of sinus venosus. Left horn of sinus venosus. Left horn of sinus venosus regress and form the coronary sinus. So the baby is having left superior vena cava and that is opening into coronary sinus. Very good. Very important question. So right superior vena cava open into the smooth part of right atrium. Left superior vena cava open into coronary sinus. Why? Superior vena cava, anterior cardinal vein open to common cardinal vein left side. Left common cardinal vein, left horn of sinus venosus, that will regress and form coronary sinus. So now this baby is having double superior vena cava. Why? Due to persistence of left anterior cardinal vein below the oblique anastomosis. Okay. So baby is having left superior vena cava and right superior vena cava. Okay. Now the left superior vena cava open into coronary sinus. Open into. If it is present, if it is open into coronary sinus. Whereas right superior vena cava, which open into the smooth part of right atrium. Smooth part of right atrium. Why, sir? Because the right common cardinal vein, right vitelline vein, right umbilical vein, they open into right horn. Right horn on the body of sinus venosus, they form the smooth part of right atrium only. I hope you know that. So this is about double superior vena cava. Okay, right. Now see the diagram. Now this is our right side common cardinal vein, and this is right anterior cardinal vein. This is left side common cardinal vein, and this is left side anterior cardinal vein. And we have anastomosis, oblique anastomosis between the two anterior cardinal vein. Now between the oblique anastomosis and this is subclavian vein. Now this one, the part I am shading in yellow color, that will form the right brachiocephalic vein. So right brachiocephalic vein derives from right anterior cardinal vein, which is present between the subclavian vein opening and the oblique anastomosis. Between subclavian vein opening and the oblique anastomosis. Okay, right. So what about the left brachiocephalic vein? The left brachiocephalic vein derives from, this is number 1 and this is number 2. This is number 1 and number 2. So left side brachiocephalic vein derives from number 1. What is our left? Number 1, left side anterior cardinal vein, which is present between subclavian vein opening and the oblique anastomosis. What is number 2? Oblique anastomosis. Okay. Number 2 is the oblique anastomosis. Okay. Now what about our superior vena cava? Now superior vena cava derives from, this is number 1, this is number 2. So superior vena cava, it is coming from number 1, that is our right anterior cardinal vein present below the oblique anastomosis. Okay, what is number 2? Right side common cardinal vein. I told you the counterpart, left side. That is our, this part. Left side anterior cardinal vein below the oblique anastomosis. Below the oblique anastomosis, that will regress. Okay, right. So that's all about our superior vena cava formation. Okay, right. So now we're going to see the development of inferior vena cava. So now the inferior vena cava, now this is our posterior cardinal vein. I told you the anterior cardinal vein drain the blood from the upper part of the body, and the posterior cardinal vein drain the blood from the lower part of the body. No? So now this is our right side posterior cardinal vein. Right side posterior cardinal vein. Similarly, this is left side. This is left side posterior cardinal vein. Okay. And now we have anastomosis between the right and the left posterior cardinal vein. So we have anastomosis. Now that is the anastomosis between the right and the left posterior cardinal vein. Okay. Right. Now we have some more veins. Subcardinal vein, supracardinal vein. See, subcardinal vein, this is subcardinal vein. I will draw in some other color. Now this is subcardinal vein. Now subcardinal vein drain the renal segment. That is, it drain the renal part of the renal segment of IVC. So the orange color is our subcardinal vein. Now the subcardinal vein, which help in the formation of the renal part of the renal segment of IVC. Renal segment of IVC. Now it also helps in the formation of renal vein, drains the kidney. It forms the renal vein and the gonadal veins. This is very important. The recent exams, 2021, I think, the INCT exam, we got this question. Okay. So subcardinal vein form the inferior vena cava, renal vein and the gonadal vein. Okay. So next we have supracardinal vein. Supracardinal vein, let us draw here like this. That is our supracardinal vein. See, supracardinal vein help in the formation of supracardinal vein, green color, right and left supracardinal vein, help in the formation of inferior vena cava, intercostal veins, intercostal vein, and also helps in the formation of azygos system of veins. So azygos system of veins means the azygos vein, left hemiazygos vein, left accessory hemiazygos vein. Okay, so the entire thing called azygos system of veins, that is coming from supracardinal vein. Okay, right. Next, we have anastomosis between the two subcardinal veins, and we also have anastomosis between. We also have the anastomosis between subcardinal vein and the supracardinal vein. So, okay, anastomosis between subcardinal vein and supracardinal vein. So now IVC derived from, we're going to write one by one. So the cranial part of inferior vena cava is not coming from right common cardinal vein. The right common cardinal vein will form the superior vena cava. The cranial part of inferior vena cava is coming from right vitelline vein. I hope you remember that. Okay. Now please write this point. This is very important. See, the right side cranial part of vitelline vein, right vitelline vein, cranial part is forming the cranial part of IVC. The inferior vena cava is not coming from right common cardinal vein. The cranial part, the common cardinal vein, right side common cardinal vein is forming superior vena cava. Just now I told you. Okay. So now the posterior cardinal vein, right side, help in the formation of IVC. Okay. Whereas right common cardinal vein help in the formation of superior vena cava. Now right cranial part of vitelline vein help in the formation of inferior vena cava. So now I am drawing this diagram. Now this is our, that is our right vitelline vein, cranial part. That is going to form the cranial part of IVC. Okay. So now we're going to highlight in yellow color. Now this one. That is our right posterior cardinal vein, number 1. So we're going to write the sources for IVC. Okay. So number 1, the first source. So number 1 is the right posterior cardinal vein. The part which I highlighted, no, that part is called sacrocardinal vein. So sources for IVC, number one. What is number one? Number one is sacrocardinal vein. So please write IVC derived from inferior vena cava derived from number one. So number one is right side sacrocardinal vein. Right side sacrocardinal vein, number one. Number two, this one. I will highlight in green color. This is number two. What is number two? Number two is green color. What is green color? Supracardinal vein. Right supracardinal vein. So number two, the second source of inferior vena cava is right side supracardinal vein. Okay. Number three, this one. I will highlight in pink color. This one. That is number three. What is number three? Number three is the anastomosis between right supracardinal vein and subcardinal vein. So that is number three. So number three is the anastomosis between right supracardinal vein and subcardinal vein. Okay, right. Number four, I am shading in this blue color. So this one. What is number four? That is our right subcardinal vein. This one. Number four, right subcardinal vein. Okay. And number five, we have anastomosis between the right vitelline vein cranial part and the subcardinal vein. This one. I am marking this as number 5 and this is number 6. What is number 5? Number 5 is the anastomosis between the subcardinal vein right side to the right vitelline vein. So number 5 is the anastomosis between the right subcardinal vein and the right vitelline vein cranial part. Right vitelline vein cranial part. Okay. And last, number 6, right vitelline vein cranial part. Okay. So these are the 6 contributions for the formation of our IVC. So from here, we use some other color. This is number 5 and one more color we use, and this is number 6. So these 6 sources. So the inferior vena cava is coming from right posterior cardinal vein, number 2 right supracardinal vein, number 3 anastomosis between right supracardinal vein subcardinal vein, number 4 right subcardinal vein, number 5 anastomosis between subcardinal vein and right vitelline vein cranial part, and number 6 right vitelline vein. So these 6 sources, they help in the formation of IVC. Okay. Now the counterparts on the left side will disappear. Now sometimes the patient may have double inferior vena cava, double IVC, that is mainly due to persistence of left sacrocardinal vein. So left sacrocardinal vein persists, which in turn forms the left side IVC, left side inferior vena cava. Okay. So now please write the left side IVC, that is due to persistence of left sacrocardinal vein. Sacrocardinal vein. So double IVC is due to persistence of left side sacrocardinal vein. That is the main answer. That is the best answer. Due to persistence of left side sacrocardinal vein. Okay, right. So that's all about the inferior vena cava formation. Usually they're asking the double IVC due to persistence of left side sacrocardinal vein. Okay, right. So now we're going to see one more vein, portal vein formation. Portal vein formation question they gave in 2016 AIMS exam. After that, we didn't get the question anything about the development of veins. 2016 they gave question about the portal vein formation. In 2021 and 2019 AIMS exam, the questions from the contributions given by supracortical vein, subcortical vein. I told no, supracortical vein help in the formation of IVC, help in the formation of intercostal vein, azygos vein. Subcortical vein help in the formation of IVC, renal segment, and the gonadal veins and the renal veins. So questions came from that area. So, right. But in the future, yes, you may get some question about the image-based question about the portal vein formation. Now see the diagram. See, portal vein, it is coming from the vitelline vein. So we have the two vitelline veins. We draw the line diagram and then we see the diagram here. Okay. Now this is our sinus venosus. Sinus venosus, each horn receiving the 3 set of embryonic veins. I hope you know that. Now this is our sinus venosus body, and this is the horn of sinus venosus. Okay. Right. Now this is our vitelline vein. So now the vitelline vein is here. This is our right vitelline vein, and this is left vitelline vein. The right vitelline vein and left vitelline vein, they are formed on either side of duodenum. Duodenum will be here like this. This is duodenum. That is duodenum. Okay. So right vitelline vein, left vitelline vein, they are formed on either side of duodenum. So now this is our duodenum. Okay. Now the vitelline vein, before open into sinus venosus, they passes through septum transversum. They pass through septum transversum. Septum transversum. Okay. Right. And then they open into the corresponding horn of the sinus venosus. Now we have 3 anastomoses between the vitelline veins. 2 ventral and 1 dorsal. See the diagram. Now this is our right and left vitelline vein. They are formed on either side of duodenum, and they pass us through septum transversum, and then they open into sinus venosus. Now we have 3 anastomoses between the vitelline vein. 2 ventral anastomoses and 1 dorsal anastomosis. Now after, yes, drawing the diagram, yes. Now see the actual diagram. Now this is our, yes, vitelline vein, the right and left vitelline vein. They are passing on either side of duodenum. Now before open to sinus venosus, they pass us through septum transversum. I told you we have 3 anastomoses. Okay, what are those? 2 ventral anastomosis, proximal and distal ventral anastomosis, and middle dorsal anastomosis. Right. Now first we're going to see the development of the superior mesenteric vein. Okay. Now superior mesenteric vein is derived from, this is number 1, this is number 2, and this is number 3. So these 3 parts will form the superior mesenteric vein. So superior mesenteric vein derived from, what is number 1? Number 1 is right vitelline vein, which is present below the distal ventral anastomosis, which is present below the, number 2 is the present below the distal ventral anastomosis. Is that clear? Right. Number 2, what is number 2? Number 2 is distal ventral anastomosis. Okay. Number 3 is left vitelline vein, which is present between the splenic vein and distal ventral anastomosis. This is a very small part. Distal ventral anastomosis. I'm talking about the small part, this one. So number 3 is left vitelline vein, which is present between the splenic vein and distal ventral anastomosis. Now these 3 parts help in the formation of superior mesenteric vein. What is number 1? Right vitelline vein, which is present below the distal ventral anastomosis. Okay. What is number 2? Distal ventral anastomosis. What is number 3? Left vitelline vein, which is present between the splenic vein and distal ventral anastomosis. Is that clear? So, superior mesenteric vein derived from both right vitelline vein and left vitelline vein, but major contribution for the superior mesenteric vein is given by right vitelline vein. So, sometimes they may give you this question, superior mesenteric vein is derived from. In that case, please go for right vitelline vein greater than left vitelline vein. They may ask you single best answer. Major contribution is given by right vitelline vein only. Right vitelline vein greater than left vitelline vein. Okay, right. Now splenic vein develops independently and opens into left vitelline vein. Okay, leave that. Now next, we're going to see the formation of portal vein. Now portal vein derived from, I'm going to mark the source. Now this small contribution from this one, and this one. Now these three, 1, 2, 3, they form the portal vein. So portal vein derived from, okay, now what is number 1? Number 1 is left vitelline vein, okay, that is present below the dorsal anastomosis. So now we're going to write portal vein formation. Number 1. So number 1 is very small contribution that is coming from left vitelline vein. Now the left vitelline vein, which is present between the splenic vein opening, and middle dorsal anastomosis. A very small part, middle dorsal anastomosis. Is that clear? So portal vein derived from left vitelline vein, small contribution from the left vitelline vein. This small contribution. So this segment alone. Okay, this part alone. The left vitelline vein, small contribution. The left vitelline vein present between the middle dorsal anastomosis and the splenic vein opening. Okay, what is number 2? Number 2 is middle dorsal anastomosis. Number 2 is middle dorsal anastomosis. Okay, number 3. What is number 3? Number 3 is right vitelline vein. Right vitelline vein. Now this right vitelline vein is present between, see here, the proximal ventral anastomosis and middle dorsal anastomosis. That is number 3, no? So number 3 is the right vitelline vein, which is present between proximal ventral anastomosis. Present between proximal ventral anastomosis and middle dorsal anastomosis. Okay, so number 3 is the right vitelline vein. That is a major part. The major contribution to the portal vein is given by our right vitelline vein only. So right vitelline vein, number 3, that is present between proximal ventral anastomosis and the middle dorsal anastomosis. Now these 3 form the portal vein. So portal vein derived from, number 1, the left vitelline vein, small contribution from left vitelline vein that is present between the splenic vein and middle dorsal anastomosis. Number 2, middle dorsal anastomosis. Number 3, right vitelline vein that is present between middle dorsal anastomosis and proximal ventral anastomosis. Now these 3 form the portal vein. Now portal vein derived from the right vitelline vein and left vitelline vein, but major contribution from right vitelline vein. So portal vein again, which is derived from right vitelline vein greater than left vitelline vein. Both will contribute, but major contribution from right vitelline vein. Okay. So now see the diagram. So portal vein formation. So portal vein is coming from 3 sources I told you. That is the left vitelline vein, small part, and this 2 is a middle dorsal anastomosis, and this is number 3, that is the right vitelline vein present between the proximal ventral anastomosis and middle dorsal anastomosis. So these 3 form the portal vein. I told you portal vein is coming mainly from right vitelline vein greater than left vitelline vein. Okay, that's all about the portal vein formation.